This virtual consultation is on transgender hair transplant, something I do quite routinely. And I want to clarify what this means, because I'm not talking about female to male or FTM, because that is specifically oftentimes just doing transplants into the face or facial hair. I encourage you to watch the facial hair transplant video, which encompasses that component. What I'm really talking about in this situation is MTF, male to female, which really mainly is female hairline design. I encourage you to watch female hairline design virtual consultation, because whether it's cis or trans for female, it's the same design principles are there. However, there are other subtleties that are very important when we're talking about the trans patient, when we're looking in the frontal hairline. The first is whether that person is stable. So has that person undergone HRT, has that person undergone SRS or something else that would stop the male hormone component? Because with ongoing DHT issues, that if they haven't been properly addressed, there can be progression of that loss where it's then hard to recover. Then it's almost like a cis male when I'm dealing with that progression of hair loss. So the first question I always ask is, have you been able to hormonally suppress progression of the male pattern loss? If you haven't, then we have to talk about all those components of how to stop it. Now, for me, I don't deal with the HRT component. I always, have someone else. I'm hoping you already have that person. I'm not going to deal with the HRT. However, if you're still in that process of deciding whether to progress forward with everything, I will help you out with at least starting finasteride or something else so that we can control the situation until you see the person for HRT. So progression of hair loss is one of the big things that I'm looking at. The second component that I'm looking at is timing of FFS, facial feminization surgery. If there's a large component of my patients that neither do not undergo FFS or SRS, even fewer undergo SRS, sexual reassignment surgery. So a vast majority of my patients don't undergo FFS or SRS. But if they do undergo FFS or facial feminization surgery, then usually what I recommend is to wait on the transplant until you've done FFS for at least 4 months, preferably 6 months, 3 to 6 months, somewhere after let the scars heal, because for a few reasons. One, if you're going to go FFS, they will advance the hairline to the best of their capacity, not as well as I can do with the hairline design, but at least they can advance it far enough that you've already leveraged that. You've already got the results of some of the advancement, which is already beneficial for you, where you can save doing a transplant, partly because it's been moved forward. The other reason is that FFS will lead to a scar that oftentimes is hard to completely camouflage. And the direction of the hair still look not as feminine as possible. So in general, I would really encourage someone to finish FFS, wait a few months before I undergo the hair transplant procedure in terms of timing. But that's not always the case. I have patients that say, look, I don't even know if I want to go through that. I'm not too certain. I'm still in this process of deciding, but I really want to have hair up there. If they've got good donor capacity in the backside, I want to go ahead and help that person develop a better transplant, then I'll help her build the transplant with the full knowledge that that person understands that she may have to undergo a subsequent transplant to touch up the procedure after FFS procedure. And that's this thing that I'm always sort of having that dialogue on the front end during consultation. And those are probably the two biggest topics that come up early in the consultation: is where are you with HRT or SRS or whatever it may, one of those two. And the second is, when are you doing FFS? Or are you going to do it? If you're not going to do it, then we can talk about transplant. So those are sort of unique to the MTF trans patient. Let's talk specifically about, what am I looking at? So this is that difficult situation because I'm dealing with a trans female that is needing a transplant. I need to see what donor capacity is there. Some benefits, if you're on HRT or have undergone SRS, then I know on the long end that my DHT sensitive follicles are not going to be as prevalent or as present. So that's one thing really, really nice, is that on the back side, as I transplant to the front, that area will not have the susceptibility where I'm going to constantly try to do more and more because there's ongoing wave of loss. So I feel so much more confident that I can treat you almost as a cis female, that I'm not worried as much about that progression. So that's one thing really good. Now, how do I go about designing it? So this is another component that's out there, is some of my MTF trans patients sometimes still like wigs. Sometimes they like the hair camouflage that provides a density. Sometimes I don't have enough to provide a full transplant because they've waited too long with progression. Can I still do a transplant? Yes. So not always, but in those situations where the person is more interested in having a full head of hair and I can't provide it, then I encourage her to do the transplant to the frontal scalp and provide density there. And then we can use some kind of hair piece or hair wig somewhere on the back side to provide that density. Of course, with someone skilled that can match the color, everything like that, so it looks good. Why is that? Because the front is harder to achieve a very natural result using hair pieces, wigs, etc., whereas the backside is much easier to accomplish. So sometimes I'm doing a frontal transplant and allowing a camouflage in the back with appliances or wigs and things like that in the person that just doesn't have enough hair to do that work. So I know this is complicated. There's so much more information. What I encourage you, instead of having to be redundant, is I encourage you to if you're talking about a female hair transplant to the front, I encourage you to watch the video on female hairline design. And I go through all that because it doesn't really matter if it's cis or trans for MTF female, because I'm still designing a similar design because I'm replicating what a cis female has. Of course, if there's any questions, I'd be more than happy to answer them during a consultation, but those are some of the basic principles you should know about.